Hello, everyone, and this is Kelly Miners, and this is my introduction for this class, Theoretical Foundations of Teaching and Nursing. I just wanted to start to say I got my BSN in 2000 from Research College of Nursing, Rockhurst University. I started college in 1995 as a biology major and decided to switch from biology at the second semester of my sophomore year to nursing. I was thinking about going into physical therapy, but the more I got to know the nurses, heard what they were doing in school, and all the stuff that the job required, I thought that nursing was more of my calling. And I'm very, very happy I changed my major when I did. So I graduated from Research College of Nursing, Rockhurst University in 2000. When I was a junior, my second year in nursing school, I did a summer 3 internship at the Mayo Clinic. And that was a really, really cool thing to do. So what I did is I went up there for the summer and I worked as a nurse intern. And that would have been in 1999. And I worked full time. There were 1,000 people from all over the United States. They gave you a place to live. You had some orientation and all that, and you worked with a nurse. And it was really, really cool to be able to do a lot of the things that I did. I did go back and work there after graduating from college, and I worked there for almost 2 years. It really helped with my orientation and making it a lot less scary. I really enjoyed the med surg unit that I worked at. It was very, very intense. There were sometimes we took care of patients that had up to 12 drains. So I got to see a lot of very cool post-op surgeries that I wouldn't have gotten to see in Kansas City, and do a lot of things. After that, I went back to Omaha from where I'm from and worked at Creighton University Medical Center. That's when I transitioned into the ICU. That was a 30-some bed ICU, and we took everything. We took post-op hearts, we took surgeries, we took medical patients, we did overdoses, we did traumas. It was a very, very busy unit. Uh, and I ended up leaving there after 2 years to come back to Kansas City. The hospital, who was running the hospital, as far as management and stuff, I just thought I could do maybe a little bit better, and that's when I came to St. Luke's. When I came to St. Luke's Hospital in 2004, I started in neuro ICU, and I was there for about 15 years. I really enjoyed my position there. I ended up being a clinical resource nurse. I charged from about the first year on. I've precepted tons, probably over 250 new nurses throughout all those years, and just did a lot of stuff. And now at the end of August, I just transitioned into a system nurse educator role, and I'm in charge of two different hospitals and the float pool as far as managing the nursing education. So I'm counting my current practice as part of the neuro ICU and system education because I feel like I'm transitioning between the two and I haven't been in system education long enough to really call it my home yet. Neuro ICU, we took care of aneurysms, we took care of strokes, we took care of traumas with traumatic brain injuries, and then sometimes you get overflow from different other ICUs. I worked at St. Luke's on the Plaza, and they had four ICUs: a CVICU, a CICU, medical ICU, and then a neuro ICU. So again, I just transitioned into the system education department where I do teach a lot of classes, but I've taught classes probably since about 2006. The very first class I ever taught at St. Luke's was a introduction to cardiac rhythm class, and there was two 8-hour days, and I was the only person teaching that whole class. So that was a little bit of a bang for introduction. I've also taught probably about 15 to 20 classes throughout the years as far as like 1 or 2 hour lectures here or there, usually on neuro topics, sometimes on precepting topics because I've been very heavily involved with our preceptor program that was started about 4 years ago here at St. Luke's. And now with system education, I'm teaching other classes too. I just taught a CCRN review class. I've taught a few stroke classes so far this year. I really enjoy teaching. I really enjoy trying to make PowerPoints. I've learned a lot about how much information to put on slides and watching different presenters throughout the years to determine what would maybe be the most beneficial way to teach adult learners. In 5 years, I guess to explain this slide, I have 4 kids right now. And so my oldest is Charlie. So I think about a lot of things in relation to where my family will be. So in 5 years, my oldest will be 15 and my youngest will be 10. So I'll have ninth grade, seventh grade, sixth grade, and fourth grade. I will be 48 years old and my husband will be 55. I'm not sure where I'll be in 5 years. My director just asked me the same question not too long ago. I think right now, with school, starting my first full-time job with all 4 kids, learning a new job that I haven't had to learn for. I mean, this is my first new job in 15 years, and learning how to transition over and finishing school. I mean, my main goals is I will be out of school. I will be an expert in my position. Um, and I'm not sure where the road will take me. I've thought about teaching at the college level, and I may eventually go that route, but right now I just want to finish school and be really good at the job that I'm doing. So, the inspirational quote that I chose is reason is the natural order of truth, but imagination is the organ of meaning. And I really like C.S. Lewis, and I really like this quote because I use a lot of reason. I've used reasoning throughout my whole career, and it's gotten me to figure out a lot of things. But to really be able to troubleshoot and think outside the box when you're trying to figure out a patient or you're trying to figure out how to get someone to understand something, that's where I feel like I am very energized and really enjoy doing. So I'm excited for this class. I'm excited to learn about everything. And thanks for listening to my presentation.